can be able to confirm that, I think that will be better. And then, secondly, the issue of FIF. I don't know whether we've already gone through and we've agreed that every facility will give its own report for us to be able to see. I'll congratulate Mandela for doing the FIF, but there's a big possibility as well, the way that I'm seeing it. A number of counties, and my team is not here, but there's also a concern whether the other counties are reporting to COB. Are we reporting to COB our collections for FIF in every facility? Yes, but you see, because I'll give you an example, and I'm just concerned. I need to be able to check. I've asked my team to see me later on in the evening today, and I'll raise this as well with them. But just Coast General alone, I think our turnover is $1 billion plus, one facility. You've got another facility that is in hundreds of millions, another one hundreds of millions. I don't know how feasible it is that other than Nairobi and probably Kiambu because of their population, how it is possible that we're not ranked, because everyone, by the way, has seen an increase in the amount of people. Mombasa has seen an increase in the patients visiting our facilities because we've registered more people in SHA. But let me raise it up with my people. My gut feeling tells me otherwise. Do we want to add anything else, colleagues, on this before we move to the issue of the human resource?
Maybe. I think for Mandera could be in terms of percentage, not maybe in terms of amount. The increment is, I think, percentage. Your suggestion, Your Excellency Chair, I think is very valid. But even at when we customized the FIF, we had proportion for the facility in terms of development and recurrent, and then we also have support to the county or sub-county health management team to make sure that we supervise the work. So maybe in that case, you can maybe factor in that a facility, a bigger facility can still support the facility with low volume.
Do we want to add anything else on the issue of health financing?
Your Excellency, there's a question that we asked the control of budget when she came to this meeting, to the CEC's meeting, as to why she knows that facilities, there are so many facilities within the county and they must open those accounts because 43 counties have opened the special purpose account. And one of the things that she raised is like there must be a processes for actually reporting to the control of budget, and some of these facilities that have been opened are not documented with the control of budget office. So they only report on the facilities that they are aware are existing, and those are the ones that have been recorded with them. But the ones that have not been recorded with them is like ghost facilities. Maybe Robert is also on call. We were with him at that time. Maybe if he can say something about that. Robert?
Okay, so two issues why the control of budget is flagging the many accounts. Number one, there are a lot of accounts that were opened for special purpose, the ones that were for grants, like the ones for THS, the NIDA. So these were accounts that were open for projects, but they already ended long time ago. Others are dating back to pre-devolution, but they're still functional. So those ones are flagged. The number two, for the current accounts, the procedures per the PFM, each account is supposed to be opened by the CC, Treasury, Finance, and a copy of that account is supposed to be submitted to COB. So a lot of the accounts have not been opened through the process, and the copies have not been submitted to COB, and that's why she's flagging those accounts. Thank you.
There's something that I'm hoping the Secretariat can be able to also inform us and probably present. Like we are all aware, USAID is gone. Danida is its last stages. Do we have any, I know that we're planning for a meeting with donors, but do we have projects? I'm aware, I think during the inaugural meeting that I met with the Secretariat, there was the programs that we were proposing for us to kickstart, because they've been there, and I think they were being discussed for a long time, but they've not taken off. Are we aware whether there's any information on the whereabouts of how they've started? I think it's a World Bank project, isn't it? Maybe we can ask Athar to just, because that involves directly the health financing aspect.
That is something that is also in the presentation. Probably after the human resource, we can be able to report on those upcoming programs. If that is allowed.
That's fine. That's
okay.
fine.
Thank you, Excellency. I think that is it for health financing. And then on human resource, just for the sake of the new members, in 2022, the MOH through PSC recruited approximately 9,724 UHC staffs across various cadres for 3 years. That is between April 2022 and 2023 May. Under the UHC program, approximately 8,550 UHC workers have been deployed in all. This for UHC staffs are currently being processed by the Ministry of Health. So the payroll is with the Ministry of Health. Extension of the contract was done after that expiry in May 2023 for a further 3 years, which will lapse between April and October 2026, Excellencies. So in the financial year 2024-2025, MOH wrote to COG requesting the county government to absorb the UHC staff as per the SRC approved remuneration. There's been a lot of consultation between the two levels of government on the same. And then given the financial constraint, county government says they are not able to take up the UHC payroll at the SRC rate. So on transition of UHC staff, a joint meeting between, I'm just reading the scenarios and how it happened, a joint meeting between the MOH and the Council of Governors held on 2nd September 2025 resolved that while still on contract, the salaries of UHC staff will be enhanced from the current cumulative to approved SRC rates. So from September 2025, the UHC staff remuneration were enhanced as agreed. However, their payroll still remain with the Ministry of Health. So the total budget required for smooth transition as per the calculation by the COG was close to 7,801,442.85, excluding the 15% of the basic salary for employers' pension contribution. So the challenge is like series of industrial action by healthcare workers on a number of issues, including salary delays, late share deductions leading to access in healthcare. And that is why you found like healthcare workers always on the street on the same. So our recommendation on this, Your Excellency, is the National Treasury to avail resources through the equitable share to counties for the absorption of UHC staff as per the SRC approved remuneration. Because up to now that has not happened, as much as they have been transitioned to P&P, the payroll is still with the Ministry of Health, and UHC payroll also to be transferred to the respective county government, since actually HRH is a devolved function, and then national government to ensure regular and timely disbursement of equitable share to the county government to curb issues of salary. And I remember the Chair Emeritus actually raised this and said we have to have this in equitable share, so that there's that sustainability. So still, we have issues, and we've been seeing things on papers that those UHC staffs are now going to be posted, all of them, to the national government. So I don't know where we are as at now, because it's still, this issue is pending. As much as they've been transitioned to P&P, the payroll is still with the Ministry of Health, so the things that have been agreed upon by the two levels of governments have not been achieved. That is for human resource, Your Excellencies.
Another question is whether they put this in the budget. Salaries for UHC. Okay. Now, you see, if they didn't put it in the budget, how are we meant to take them? Because you see, we are distinct governments. The day you give those letters of permanent and pensionable, there'll be no issue. You see, the UHC staff, the agreement we had was that the resources will have to come. If the resources have not been budgeted for, and you go and issue a PNP letter, then basically all counties have committed themselves. Because there's nowhere in law that will say that we can't pay this section because the resources do not come. And we need to be able to make a decision on this, and I'm proposing the right way for us to be able to go through it is say that yes, we want these doctors. We're asking Treasury to hasten the process of allocating and transferring the resources. Because salaries cannot, it is not something that you can be able to tell someone, wait until we get the money.
Issues budget in Treasury are to a large extent controlled by Parliament. So if we can engage the Parliamentary Committee on Health on the agreement between Council of Governors and the President during the summit, that the funds be made available for, is it the summit or the IBEC? Be made available for county governments to be able to pay the UHC staff. Then that matter should be raised at the Parliamentary Committee so that Treasury can be compelled. Although, of course, we can ask Treasury, but if Parliamentary Committee on Health does not concur, they can even put that money in the budget and then it is removed at the Parliamentary Committee stage.
Your Excellencies, this issue of UHC has been going forward and back, and I tend to think the hastened approach by national government, Ministry of Health, was actually to compel the counties to issue letters of PNP without knowing how this payroll will be sustained. And that's why in our last council meeting, it was agreed that there will be no issuance of permanent and pensionable letters to UHC since their contracts are coming to an end between April and May. So if they really want the counties to absorb them, then they should have provided for budgetary allocation at that point. And then the Chair Emeritus guided that we will start conversation thereafter when the contracts have lapsed, because the ministry says it has money up to the lapse of their contract. So meaning they wanted to trick us, we give them letters of PNP. Then it will be left now on your faces to ensure that there is continuity without resources. So I think the best thing is we wait until the contracts lapse. Then if the ministry wants us to absorb them, then they will be compelled to provide the budgets. If they don't, 882? No, those 8,200, those that were...
It's 7,600. How many? 7,600.
8,200 is what was verified.
The current UHC?
Yes.
It's 8,550.
8,550?
Yes. Yes. You know, we had to align because their figures were basically... This is what we've actually collected. Remember, we aligned with them and we did audit. And so this is the number that was shared by our team.
And then we we have with the ministry on who's going to pay. By the time we are waiting until the end of the contract, the staff will be out on the streets, or they will not be serving in the facilities. So I feel that we should take steps to see that the budget, these funds can be included in the next, is it the next budget? Yeah.
Thank you, Chair. You know, from the word go, the ministry had no intentions of continuing paying this stuff. The way this idea was conceived, Chair, during the COVID or thereabout, is that some support came from donors. And therefore, the Ministry of Health was not ready to give these monies to the counties to employ that time. They had to do it themselves by retaining the payroll, and we do the employment. And up to where we are at the moment, they have no intentions whatsoever, because I've listened even to the highest office in this land, of paying health workers who are working in the counties. The idea was to make us be able to commit ourselves in writing, which we never did, so it becomes easier to offload them. At the moment, there's an illegality in that the ministry has increased the salary of UHC staff without due procedure and without any documentation. They have a payroll that is reading whatever is reading at the moment. But if they were to be asked by the bank, give us a letter of appointment to support your pay in the bank, they do not have it. And that is why at the end of the contract next year, once the contract elapses, the ministry will just stop paying them. So Governor Chebu is right to say that we are staring at a problem which will be a blink of collapse of health facilities in the counties, very many of them, depending on how many staff you have. So you can imagine pulling out at once, on one day, 8,500 staff from the whole of Kenya, because that is what is going to happen. And the onus will be on us, or the responsibility according to the ministry. They'll say, those are your staff, either fire them, rehire them, because they are the ones who are working for you. So the counties must start being prepared, depending on how many staff you have, on what to do, whether you're going to replace them, have your budgetary allocation, whether you're going to let them go and hire others, or you downsize your services to suit your pocket. I don't know about the other counties, but in Tharaka Nithi, I'm supposed to spend around 230 million extra to take care of those 1,700 staff. So I do not know exactly, not 1,700, sorry, but I think it's around 317, yes, 317. So you can imagine how many staff you're going to lose and how much. Can I be able to afford 230 million on my payroll at the moment? Even if I had the money, my wage bill will shoot to around 70%. Even if I had that money. You know, already you've broken the law. And where do you get an extra 200 million from your budget without any extra exchequer? Just to confirm, as I finish, Chair, that there was a sinister motive in what was being promised verbally by the ministry. When we went for IBEC last time, it is Governor Sang who raised it. The proposed increase to our equitable share at the moment is only 5 billion. It is not even enough to take care of UHC workers, leave alone another yearly increment. That is what they had proposed in the initial negotiation for IBEC for the next year's DORA. So why couldn't it even start by saying we have put 8 or 9 billion, which was inclusive of gratuity, should come to around 10 billion. So if they have not even put that basic for UHC, leave alone giving you no yearly increment. That tells you they have no intention of doing it. And as usual, we will go to the summit. Chair, be prepared, because you will lead us in that, and put our foot forward that we would like to have this money. It will be a conversation there, but the moment DORA comes, you'll be very surprised. It will not be there. And that is why we should be ready and prepared on how which is the best way to handle it. I remember the only time we were able to be effective in anything is when more governors walked on foot to High Court one time. Was it High Court? When we needed increment in DORA. Was it High Court? It was Supreme Court. That is the only time we were hard, that we had to go to the streets for mandamano for this to happen. I don't know that we need to do the same again, because that is just going to collapse the delivery of health services in this country. Yeah.
There's a document that I have with me. It's not yet been passed. It's actually, it has already left the Senate, and it's gone to the National Assembly. The Senate approved this, and they've added a new schedule, the fourth schedule. And I think it's important we allow our teams to go through this, because in this, there's, this is the county government's additional allocation. It's already passed the Senate and currently National Assembly, and there's a proposed amendment to include a fourth schedule, which actually has a line item called primary health care in devolved and context program. So we need to confirm, first of all, what exactly this is. Then secondly, before we make a statement on this, there's another line item that they've included here, and the line item is on payment of doctors' arrears. Yeah, there's two here. One of them, there's what was passed, and then they came up with an amendment. In fact, there's going to be an extra amendment on the issue of KDSP as well. I'm aware that they've already sent the proposed amendments. However, as we speak right now, there's a line item for primary health care, and I'm just seeing a county like the figures that are being quoted for Mombasa are around 11.3 million, which doesn't add up.
Chair, can I intervene just briefly? Chair, county additional allocation is never a progressive figure. It can reduce to zero the following year. The only sure bet in having money that does not reduce is DORA. So if you're told you'll be given any money for absorbing staff in SIGA, and that is a bit, it will just be one-off, because many conditional grants there are one-off. We know conditional grants that are there, so many of them. Just have a look at them, Chair. And they will not be there next year. So if we want to give us money for posterity, then it has to be in the DORA, because the DORA will never reduce. So SIGA, don't even have a look at it. It could be something totally different.
But, you know, the reason why I'm raising this now is DORA had already passed. So when this conversation started for UHC staff to be absorbed, please bear in mind that DORA had passed. You know, let's not also figure out a way of shooting ourselves in the foot. Either we now say that if this is what is in the conditional grants, that means it is for funds just for now. That means we cannot give PNP. We'll only give contracts based on that money that has been given. I understand. Yeah. But what I'm saying, and I think it's important our teams go through it, Because you see, this is a document that has not been assented to even. It's a document that is currently, has already been passed by the Senate, and it is currently at the National Assembly. This is the current one. You know, the conditional location grants, there was also extra money that was meant to be coming in for the KDSP. You know, the KDSP program, they had only approved the 30-something million for 2 years, which was just for us being able to sort ourselves in the oversight. I think there's someone who wants to speak. Sang, we can't hear you properly. You wanted to say something?
Yes, Chair. I wanted to make a point.
Yeah, go ahead.
Chair, I think what you on this issue of UHC staff, the question is not about this current financial year. The question is actually in the coming financial year. Because if you heard what the ministry have been saying, is that they have been saying they have money for this financial year. Wherever they get the money, they say they had the money to January, and then they will look for some money in the supplementary to push it to the end of this financial year. Well and good, you know, if they have the money for that, that is fine. But the question of about staff in and see be affected in the coming the financial obligation will be on us at the end of the current contracts, the running contracts of this bank. And what we have said is exactly what Mudomi Njuki is saying, is that then for us to convert them into P&P, we have to be assured of resources into the future. And the only way to have that assurance is resources being factored in the DORA. In the last IPEC, already there is a document by National Treasury that is projecting the proposed, DORA for the next financial year. And in that proposed DORA for the next financial year, there was only an increase of 5 billion. I imagine that increase of 5 billion is first the normal, the normal here, because there has always been an. So that increase of 5 billion is not even enough for the normal increase that we always require, but there is already a gap for this. They did not factor in the money for this conversion into P&P, confirming our fears from the word go that we would be forced to do the conversion into P&P, and finally there is no resources into the future. So I think for us really, that document by National Treasury alone confirms our fears that the national government wanted to throw this baby to us, and eventually the new financial year we have no resources, yet we have converted them into P&P. For Nandi County, for example, we cannot, our wage bill and our resource envelope cannot foresee a situation where we just carry over the UHC staff, not even in the current format, not even in the current contract terms, even with the current resources that we have, that were being paid before the the Ministry of Health increased their salary. We cannot be able to, we can't be able to, carry that burden, let alone now the burden in terms of the SRC terms in their current, in their permanent and pensionable. So, in fact, on this one, we must just be able to agree that if the money is not going to be available in the DORA, then the question of P&P does not arise. Then we still have to deal with that crisis that even in contract terms, counties cannot be able to stomach that cost. So I think for us really, if the money is not in the DORA, UHC staff there is no way that counties can be able to carry the weight of that wage bill in the current funding arrangement.
I'm in total agreement with everyone. The question that we need to ask ourselves is when is the timeline for DORA to be prepared and presented by executive to parliament, not our executive, but the national government executive treasury to parliament? I just want members to be aware of one thing. If we say...
It starts with the BPS. It starts, Chairman, with the BPS.
Yes.
BPS is, I think the document we are discussing in IBEC was, I think, the BPS or something. So already the process has started.
Sang, the reason I was asking this is because you see, if we go the direction and say that sweep this under the carpet until the contracts expire, what is going to happen is 26, 27 is an election year. Governors are going to be left with a burden that they were not able to deal with earlier. So instead of saying that we sweep it under the carpet, we start making noise from now. From now. Actually not even from summit. Even prior to summit, we make a committee declaration today that we are asking them to either Treasury, first of all, to give a written commitment that it is actually going to be in DORA, because you see, that is the only way, because if DORA is going to be March, chances are it might even go to April. If it did not go, and for whatever reason, senators and MPs decide to disagree, and then immediately after that, that is actually going to be the last budget that we're doing. And then you're going to have doctors out on the streets. But 27, 28, Mary, is a very, very short period. It's actually a very, very short period. So I would propose that we make an agreement here that we are asking Treasury to give an undertaking and a commitment that they will actually put it in DORA. Then now we also have to make a political decision. The political decision that I'm proposing here is we all sit down with our UHC staff. You see, if you don't give them if they don't get your voice, they'll get someone else's voice. And we show them the copies of the letters that we are ready to be able to absorb you. We want a commitment so that later on we don't have problems of your salaries. So can we agree that the committee resolves that we ask Treasury to give us a written commitment, and after that written commitment, we also start engaging, every governor engages their UHC staff and informs them that we are more than willing to be able to absorb you. We are only waiting for the commitment from Treasury. Is that fair enough? Yeah. And of course, commitment from Treasury that it will actually be in DORA, because the conversation will have to start prior. Secondly, can we also all be able to agree, we're going to allow our Secretariat to go through the document that is currently Senate has already passed and sent to the National Assembly. So that all those line items that are there can be clearly defined what exactly are they referring to, because some of these projects here, like I was telling you, there's some that they're talking about health matters as well. Can we just be able to confirm what and what those line items are? Is that fair enough? So, good.
Chairman, agreed with a small variation. We have already, the leadership of these UHC staff is known. In fact, they have engaged, Mudomi had engaged them previously, and I think even as a COG we had engaged them. Why don't you actually call them into a meeting as we as a health committee and communicate to them that our fears are being confirmed. You know, you remember they initially thought that we were against their conversion to PNP. We should actually tell them that our fears are being confirmed by already the document in Parliament emanating from National Treasury, and they have not factored in their money. So we must actually tell them, you know, we told you we have a problem with National Treasury. Look at what they have already presented in Parliament, so that they can still start the agitation themselves and support our efforts. So there is a leadership, they have a leadership already. Let us engage them and share with them the confirmation of our fears that actually the money will not be in the budget, so that then they can also do the pressure point themselves.
By the way, you know, the letter from Treasury is actually not going to be very binding by law, because the only body that is mandated to be able to approve budgets is only Parliament. So for us, this one is basically just going to be that we are waiting for this, and come the time for them to present DORA, they will really be faced with a lot of problems if they don't allocate that money. And then also, for us to start the conversation with these UHC staff. And I also think, let us agree that some of these bluffs cannot work. The reason I was asking how many doctors we have in UHC, you told me the 8,000 and? No. The UHC staff are how many? Pardon? 8,550. Please tell me how 6 facilities that belong to national government can be able to absorb 8,550 employees. Surely. How are they going to absorb them?
So that what is presented before Treasury and Parliament is embedded in CRA. Like Mudame Njuki said, there will be no funds from anywhere else outside DORA. So first of all, we need to get to know what CRA wants to put in the DORA. And then that is now going to ask, we will have to increase, or we have to propose an increase in the DORA so that it can take care of this issue of UHC. After which they can pass through Senate and Parliament, so that Treasury will just be ratifying what has been said at the law level. But still, again, this one must be discussed at the summit, so that the summit mandates the relevant organs to work with Council of Governors to prepare for transition into of the UHC staff into county government staff.
You know what's also going to happen? Governors will just have to take note of this. When they're going to present something like libraries, when they're going to present and you're told that fair enough, we will put it in DORA. DORA is a cumulative amount. It is not singled out that this is for doctors or this is for who. What is going to happen, and is what I'm anticipating is going to happen, they will quickly say yes, but when it comes to the part of DORA, they'll give us a lump figure and they'll say that we've even increased your figures, but when you look at it, what they've actually increased, a huge percentage of that increase will only go into paying those salaries. But in actual fact, there will not be a substantial increase. So I agree with Governor Chaboy's remarks that CRA needs to be very, very cautious that when they're doing their calculations, even though they're, constitutionally their input is only sought for as an advisory, it is not compulsory. So we need to be extremely careful. Again, we're also entering, I thought everyone should be aware we're entering into an election year. Those people who are passing our budgets, some of them intend to vie to become governors. So you will all have issues here. Even if they can give you the letter saying yes, come the time to present DORA, they will say that there's an increase. Senate and National Assembly will come up with a stalemate. And when that stalemate comes, we will end up realizing that the figures that there was actually increased was very, very minimal. Domi, I don't know if you've gotten me there. You'll end up realizing that increase is just for salaries alone. So maybe what we need to do is make it clear from now that these are the figures we are looking at. So whatever increase that we are anticipating should not be bordering this. Make it very clear in our communication as well. How much money are we looking at for all the 8,000 employees per year? Annually? Annually. Yeah, that's for year one, isn't it? Yeah. Exactly. First of all, the issue after transitioning them to PNP, who pays their gratuity for the contract period? And the third one?
It falls under them.
I'm just telling you, 8 billion shillings. Right now, when there's a stalemate between Senate and the National Assembly, what figures are we looking at? Sometimes
I can give you the exact figures for salary, for pensions, and
No.
for
When
annual
the last argument that we had between National Assembly and Senate, there was a time we were even arguing for as little as 10 billion, isn't it?
Yes, yes.
Now, please tell me how they are going to just blindly pass this 8 billion shillings.
It's not possible.
They will not.
But in fact, you picked my mind, Your Excellency. When you said if you advance this, it means that whatever increase they're going to consider in the next DORA, they will put it to be misconstrued that this is the money for the UHC, then meaning that counties will not get any share of revenue any moving forward.
But also the question that we also need to ask ourselves. There's two sides of the coin. What would happen if counties ended up running without those UHC staff? Exactly.
Service will suffer.
So we are caught between a rock and a hard place in a very, very big way. Even though...
Excellency, can I say something?